Welcome to our webinar on medication management in older adults. I'm the moderator, Amanda Pugh, and we have a variety of speakers and experts here to teach us about medication management and how that can be done better in our society. Okay. Here is our team of speakers today. We have Heidi Furman, who is a gerontologist, Ireland White, who is a physician, and Sydney Thompson, who is an expert in gerontology research. This is our agenda. We will discuss drugs that affect the elderly differently. We're going to talk about polypharmacy, the financial burden of medication management and effective medication management, and then understanding how to read medication labels. Before we did this webinar, we polled a group of college students and we asked them about medication management. As this pie chart shows to the right, 84% of students were unfamiliar with the term polypharmacy. Most of them thought it was going to several pharmacies to fill medications, and actually it's taking 5 or more medications regularly. Also, a quarter of participants believe that medications affect older adults differently because of brain alterations, and that will be debunked later as well in our presentation. All right, our first speaker, Heidi, will discuss the drug effect, how drugs affect the elderly differently.
Thank you, Amanda. So yes, as the title explains, drugs do affect the elderly differently. And we have listed here as because there are some benefits and side effects of medications, but typically older adults are less able to metabolize medications, so they may need a smaller dosage. And this can be related to the slowing of their gastrointestinal mobility, so that delays the onset of certain types of medication. And with aging, that can also impact how medications are absorbed and how they are processed. And then with side effects or adverse reactions to medications, there are a host of different reasons. And to the right, there are a couple listed, such as delayed gastrointestinal emptying, which I briefly mentioned. Their blood pressure, lots are taking multiple medications at a time. They may have decreased liver and kidney function, and those are vital in metabolizing medication. And at times there's inadequate testing of drugs in older adults. Many times it's among younger people who are healthier and who can engage in drug testing experiments.
All right, so like Heidi mentioned, drugs can have a lot of different effects and interactions in the elderly because of some body changes. These are some commonly prescribed prescriptions that cause a lot of these issues. So you have like your diuretics and your SSRIs. Those are going to be like your antidepressants, your NSAIDs. So these drugs in particular, like Heidi mentioned, they can be absorbed differently, which can cause increased levels of absorption, which can lead to toxic levels. And also with like the NSAIDs and anticoagulants, a lot of their bodies kind of weakened, and so it can cause, stomach tears and other issues. All right, so these are some of the most common side effects that the elderly experience with their medication regimen. So one of the big ones is increased falls, and these are commonly from benzodiazepines and antidepressants. Benzos are going to be like your Ativan and your Xanax. They're help with anxiety, but they also, kind of make them a little dizzy, which can lead to falls. Same with antidepressants. And then confusion, your beta blockers. These are going to be your heart drugs, which a lot of elderly are on, like your lisinoprils. And so these can interact in certain ways and can lead to confusion, which is difficult for the elderly already. And then like we've talked about before, digestive disruptions and antibiotics are a big one. They can severely impact like the bowel movements and have them run to the bathroom a lot. And then heart dysrhythmias goes along with the beta blockers. They just have a lot of heart problems. And so when they're taking so many of these drugs, they interact and can kind of cause these side effects that are listed on the side. All right, so like we talked about before, polypharmacy, and we have there at the bottom, it has, so the definition for polypharmacy is taking that 5 or more medications on a daily basis. And the actual risk of drug interactions, reaches above 50%. So people that are using polypharmacy have this increased risk of all these drug interactions and side effects, like we mentioned before. So some of these causes is they're going to the hospital more than necessary and just keep getting prescribed pills. Their med list isn't being looked at and reduced as their body changes. And their body kind of shuts down. They have decreased quality of life. So there are some medications that aren't really helping, but are still being prescribed and taken daily.
All right, now we'll watch a video on polypharmacy that discusses what it is and why it's important that physicians are familiar with these terms and are aware of how many medications that their patients are taking.
Polypharmacy is a funny long word, poly meaning many and pharmacy meaning medications. And many of us need to take more than one medication. But sometimes polypharmacy happens because of something called a medication cascade. We will be taking medications for a health condition. The medication may cause a side effect, and a prescriber may prescribe another medication to deal with the side effect of the first medication. You can almost imagine a waterfall or a medication cascade. So that's a reason why we should ask our healthcare professionals and pharmacists to review our medication list periodically and make sure that everything that's on there is something that we absolutely need.
Okay. All right.
All right, so the financial, sorry.
No, I think it's Ireland's next on this one too.
All right, so with polypharmacy, there also comes this really high financial burden. As you can see, 80-year-olds pay over 67% of their drug costs out of pocket because they're having these medications adding on, that the costs are just kind of rising. I mean, of course, this can affect those differently on Medicaid that have different, federal help, but it still is a heavy burden, especially for these older individuals that may not have a lot of support or funds for medications.
And I think Heidi, you're going to talk about the effective medication management here.
Yes. Okay, so like the video suggested, effective medication management is all about teamwork and really having the provider be aware of the medications that their patients are on. So number one, just don't do it alone. And your doctor needs to be aware of your health status and changes. Prescriptions need to be discontinued as your body heals. Like I mentioned, or like Ireland was talking about how sometimes they're on medications that they may not need and they just keep taking them because it's been a routine thing. So it's something that physicians need to be aware of and keep checking up on. And then reading medication labels is another way so that the patient can understand their dosage, the timing, and how it may interact with other medications. Medication labels also review a host of other issues such as side effects, which will be discussed in a little bit here.
Yes, next up we will have Dr. Sydney Thompson discuss about how we should read medication labels and what the most effective way is that it can be for elderly people especially. Dr. Thompson, would you mind explaining that for us?
Of course. So on the medication label that you get when you pick up your medication from the pharmacy, there's a lot of really important information on there. It has the name of the pharmacy along with the address and the phone number of the pharmacy, just so you can contact the pharmacist with any questions you might have. You can also find the date that you picked up the medication, along with the name of the medication and the prescription number. The number just identifies which prescription it is, so that if you do have questions, you can just tell them that number. It also has the prescribing doctor and the expiration date of that prescription, along with the name of the medication and the strength of it. So you can see here in the video, the strength would be 50 milligrams. It also says how many refills you have and how many pills are in that bottle. Along with that, it'll also list some precautions. An example of a precaution that could be listed would be to keep the medication out of the sun. There's other precautions that will be there too. It's usually on the back of that bottle on the other side of the label. As you read your medication labels, you can really understand what might interfere. There's different foods and different other medications that might cause interactions, and usually it's all listed right there on the label. Along with, if you have additional questions, just that phone number to the pharmacy, just getting access to calling the pharmacist so that you can really have the answers to any questions that you have.
Yeah, it sounds like people need to be comfortable in understanding what their medications are and being comfortable contacting their pharmacies to better understand the medication they are taking. Is that correct?
Yeah, that is correct.
Awesome. Okay. Now we're going to have a short quiz. We'll all be quiet so the audience can quickly answer these questions based off of the previous slides we have discussed, and then we will get the answers in the next slide. So we'll give you about 30 seconds to answer those questions. All right, we'll turn to our answer page. So as we can see here, that aging changes the way the body can process, absorb, and utilize medications. And people need to work with their physicians to discontinue unnecessary medications. And benzos and antidepressants are the third answer, and the fourth answer is true. All right, now we will have a short Q&A session based off of questions that were put in the chat that I will pull up right now. Sydney, what are some other warning signs on medication labels that people should be familiar with?
That's a super good question. In that same spot, you can find warnings like this medication might make you drowsy or dizzy, or do not drink alcohol while using this drug. There's also labels that say use care when operating a vehicle, along with other things like check with your doctor before including grapefruit or grapefruit juice in your diet. So that's just one example, but there's other foods that can cause interactions, especially as you get older because of that slower digestive system. So there's everything you need to know about risks of that medication right there on that warning side.
Awesome. Thank you so much. And then here's another question for either Heidi or Ireland. What are the worst side effects an elderly person could experience?
Yeah, I can go ahead and answer that. So this question is a bit subjective. The worst side effects an elderly person could experience, it really depends on the person, how good of health they're in, what type of medication they are taking, and what their health concern is. In terms of the worst, there can be a host of things like causing another health problems such as headaches. I know that can be really detrimental. It can mess with vision, and they're not able to see well, which can impair their driving. So as you can imagine, it can be a cascade of things. Other things could be weight gain, which may lead to back issues. So some side effects can just cause other health issues along with it. And I think the most common one that it could just be that the patient passes away because of drug complications and drug interactions. That would probably be the worst outcome, not usually the most likely unless the patient overdoses. But like I said, it's a bit subjective depending on the patient and other factors, but that's in a nutshell what I would say.
Thank you so much. This is the conclusion of our presentation and our webinar. So thank you all for joining us, and we hope you learned a lot.